Great. Hi, everyone. I'm Melissa McCoy. I started ConnectMed last year as part of my Master's in Computer Science thesis project at Oxford on a Rhodes Scholarship. And I'm excited to tell you today how we're taking the venture forward this year to improve healthcare access in South Africa and beyond. After interviewing over 100 South African patients and doctors last year, it became clear that healthcare is inaccessible with long wait times and limited office hours, scarce with only 8 doctors per 10,000 people, expensive with per capita health expenditures doubling over the past decade, and culturally sensitive with patients suffering from mental health and other stigmatized issues not knowing who to turn to. We started to think through a virtual solution that eliminates geographic and time inaccessibility, captures lost doctor time, thus reducing scarcity, lowers costs for both the patient and the system at large, and provides patient privacy. We decided to create this solution and call it ConnectMed, Africa's online medical practice. Given our mission is to enable all Africans to live healthier, longer, and happier lives no matter their income level, we have 2 service offerings. ConnectMed Prime, which allows upper and middle income patients to directly video consult the doctor for their common ailments over our web application, and ConnectMed Care, which allows clinic workers to directly video consult our doctors while treating lower income patients when they need further guidance. Video-based diagnosis and treatment for common ailments like cold and flu and UTIs has long been the standard in the US and UK, but no one has yet entered the South African market because of low bandwidth conditions, which our platform helps overcome, and regulatory hurdles, which we've been working through for the past 6 months. So let me explain how it works. As a patient, I merely go to connectmed.coza, sign up, and select to see a doctor now or schedule a visit for later. I enter information about my symptoms so that I spend my time with the doctor talking about my condition rather than communicating my symptoms. I also test to make sure my microphone, camera, and speakers all work correctly within the consultation. Once I'm in the consult room, a patient record pops up on the doctor's dashboard, allowing him or her to enter the consult. Over fully encrypted streaming with low bandwidth optimizations, I'm able to talk with my doctor, live chat, upload files, take photos of myself to send to better describe my condition, and much more. After the consult, the doctor enters in prescription information, which is automatically converted into an e-script that contains the doctor's signature, as well as an authentication code. If the pharmacist has any issue with the script at the pharmacy, they're able to enter this code into our website or text it to our number to verify that it's authentic. The patient can also choose which pharmacy that the prescription should be sent to. And then they get a consult summary where they're also able to rate the doctor so we can ensure high quality care at all times. This process is very similar for our ConnectMed Care application, except the clinic worker has more options of how to talk to the doctor. Honing in on our doctors, a doctor's able to enter their availability each week, and they have 3 options to choose from. Available for a scheduled appointment, available to be on call, or available just to have a consult, to get notified of. We don't actually hire our doctors, but we capture extra time in their day. Another great thing about our platform is that it produces digitized African patient data, which is extremely hard to come by. We can combine this data with machine learning techniques to create highly accurate medical tools not possible before. For example, currently we've been developing this machine learning-based triage tool and symptom checker, which predicts whether a patient should see a doctor or not based on their symptoms, and I'll be publishing a paper on this work this year. So honing in on the market opportunity, in South Africa alone, patients spend almost $700 million on GP visits per year. And given research shows that at least 40% of those consults can be handled virtually, this creates a $275 million market opportunity for our ConnectMed Prime service. This scales to almost $1 billion when you include our 5 target expansion countries in Africa. While the market size for the ConnectMed Care service is smaller, at $97 million, it's rapidly growing, as there's an increasing number of private, affordable, nurse-led clinics that are trying to meet that need and gap between poor public care and overly expensive private care. We've also been looking at the opportunity to service the public system and recently completed over 20 site visits across 5 provinces to understand core pain points and met with the Department of Health, the head of the Department of Health in Gauteng and Western Cape to understand that opportunity. Looking at our financial projections, charging $20 per consult and $300 per clinic per month, We'll break even in year 2 and reach almost $5 million in profit by year 5. In terms of our progress, we've already done a pilot of the technology, secured $25,000 in non-dilutive funding, secured insurance for our doctors in the virtual context, which was a big step, and also recruited an initial doctor pool. Most importantly, we spent several months building relationships and navigating regulatory processes within the HPCSA, and have a final presentation to them on September 14th. With their approval, we'll have the sole right to operate in South Africa and have no competition. After our launch and approval, we plan to raise a $150,000 seed round to help us reach our year 1 milestones. With a team comprised of a software engineer, consultant, clinic manager, and surgeon, we are confident that we'll make ConnectMed a reality across Africa. Thank you.
Wow. I don't know about you guys, but that was pretty mind-blowing, hey? Were you impressed? All right. Very, very interesting. So I'm looking at the panelists, and I'm looking at Marcello. Do you want to start off with your question?
Sure. Very good presentation. Thank you so much. How do you deal with the liability issues on the platform? So what happens if something happens that shouldn't happen?
Sure. All the doctors on the platform are independent practitioners, and they have their own malpractice insurance and effectively take on liability for something happening. But given that could be a lot, and also we talked with the main indemnity provider who said, we're not sure we'd cover our doctors in the virtual context. We secured extra insurance that we provide to our doctors. It costs about 5,000 Rand per year, so it's pretty affordable, and make sure they're covered.
And how about the diagnosis that you make if someone should go to a doctor or not? If you have the symptom checker, right?
Oh, right.
So if that says, I shouldn't go to a doctor and then tomorrow I have a heart attack?
Sure. So I mean, that is kind of in the future. First, the step is they have to be okay with the video consults, and then move that way. We would go for very high sensitivity, or in the sense we'd hope no false negatives, and just send more people that way. Okay. But we reached over 80% accuracies with the UK patient data that I initially trained the model on. And so we're hoping to improve that with more data from the platform.
So is your product aimed at anybody? I mean, or is it more aimed at rural areas versus urban areas?
We wanted to reach everyone, and so our kind of ConnectMed Prime service targets those who have internet connections and the devices themselves, and then we partner with clinics to reach lower income groups.
Okay. I see David's got a question for you.
I have many questions.
Okay, grab that microphone so we can hear you nice and loud. Just hold it in your hand. It's
I
easier.
have many questions.
Okay, there you go.
Thanks, Melissa. Maybe to start, can you elaborate on the insurance part you mentioned?
Sure. So I guess the virtual context where doctors are diagnosing over video, most MPS, which is the main indemnity provider here, said they wouldn't cover that. And so we talked with another insurer, Aon, who said, okay, virtual context, we'll make sure, I think the limit is up to 10 million Rand in the case if they get sued, then we would cover them and provide them that coverage. Does that answer your question?
So patients they can use their regular existing insurance?
Oh, I'm sorry, the patient's insurance. So medical aid is something that we really want to tap into soon, because most upper income South Africans have medical aid, they want to use it. We talked with Seasway and some other smaller medical aids, but as soon as we get regulatory approval, that would be one of the first things we focus on, so people can use their medical aid and not to pay out of pocket, which for the basically 300 Rand per consult.
Okay. And if I may, have you looked at sort of white labeling the product?
For like doctors' offices to use, or?
Yeah, so now you have your own doctors, and I guess that maybe limits the scalability. Maybe, I don't know, it's another question, but could you also...
If like Netcare wants to buy it, for example, or
if a clinic wants
Discovery
to use
or somebody like that.
Sure. I mean, I think kind of enterprise software is definitely another potential vertical. I think we've just been focused on, one thing and moving to the next point, but I would say, yeah, letting even a medical aid have their own portal for their people, and all of those things are opportunities. Mm-hmm.
What about privacy?
So in terms of the actual platform, our database and the streaming is all encrypted, so it's very difficult for someone just to hack in to listen in on the conversation. We have gone through kind of rigorous review with our lawyers to make sure we follow POPI and all the other laws around personal information. And we make sure that the doctor, in that dashboard, they only see the patient's symptoms. They don't see their name or anything, so only the doctor serving that patient ever gets personal information.
Tom?
Okay. You mentioned that you want to reach out to everyone. In South Africa, we still have challenges around broadband connectivity and high data prices. So what is your plan to ensure that there's a high usage or uptake, especially in remote areas?
Sure. I mean, a lot of it comes down to partnering with clinics that have internet connection, or, we don't assume the consumer will, and they'd have to. I think something we've been thinking a lot about are healthcare hubs, where we would have our own brick and mortar places that people can come into, but use a computer still to see our doctors, like facilitated by a nurse. That's a potential option. But I think given 80% of the population uses the public system, we have to work within that system if we really want to reach lower income groups and remote areas.
Go ahead, Tom.
How do you intend to deal with competition, especially if medical aid themselves decide to come up with the same solutions?
Sure.
And also on that as well, I mean, at the beginning of next year, the Tricorder X Prize is going to be announced, the winner is going to be announced. We're talking about devices that are going to cost $150 that you can start self-diagnosing yourself. So this medical industry is about to undergo massive changes. So
Sure.
What about competition such as that Tom is talking about?
Sure. I mean, one, I guess, is first mover advantage, but really what comes into play is this regulation. So a lot of companies, Hello Doctor, NTN had an initiative that tried to launch something similar but not video-based and got shut down by the HPCSA in 2013. So if we get regulatory approval, any other competitor would have to go through that process, which isn't a clear process by any means. So that adds some competitions. And once we're in the market first, we can capture more patients and hopefully make our platform sticky so people are more inclined to stay.
Final shot, David.
Yeah, maybe just further to the question from Tom. I think you mentioned the no competition, or you used the words no competition,
Yeah,
which is
that
like
was
a big
poorly said.
alarm bell going off right there. Maybe just a last question. So in my experience, the medical field is very risk averse, it's very conservative, and it might take you, quite so many months or maybe years to get regulatory approval. Do you have enough funding, and is your team ready to, to go that far?
Sure. We've put quite a few months into the process, but they could say no or maybe in September. So we've been developing kind of an alternative plan to potentially enter Ghana or Nigeria. Again, that will create some more, but I think we can't just sit around and wait. I think we can push this process and then try to launch in another market, and that's what we would try to do.
Fantastic. Thank you very much. Melissa McCoy from ConnectMed. Great presentation. Thank you very, very much.